For what purpose does the gentlewoman from Georgia seek recognition? The gentlewoman is recognized for 5 minutes.
Health care is an issue that is deeply personal to me. I myself, like millions of Americans, live with a pre-existing condition. As a 2-time breast cancer survivor, I understand what it is like to have your life turned upside down by a diagnosis. Treatment was exhausting both physically and emotionally. I did it all while raising my family and working full-time. I was terrified. Despite being lucky and having health insurance through my job, I was still worried about my financial security. I was concerned about making it to my radiation treatments every single day, sometimes for weeks, and then back to work and then back home to raise my son Jordan. I had to do it, just like millions of Americans out there who share a similar story like mine. And I truly don't know what I would have done or what would have happened if I had lost that health care insurance. Over 300,000 Georgians in my state, in my district, have a pre-existing condition. Over 45,000 of those people are children under the age of 17. My colleagues here are worried about the health and well-being of their constituents. And we have heard countless heart-wrenching stories from Americans across the nation, our neighbors, our friends, and our loved ones. Americans are simply worried about their health care. I am worried about their health care. They are tired of these games. Let's stop playing politics with the health and well-being of the American people. It just needs to stop. Last year, the Trump administration allowed the expanded sale of junk insurance plans, many of which do not cover maternity care, mental and behavioral health, and coverage to treat pre-existing conditions. Under these plans, women can be charged more than men. Insurance companies can cancel coverage as soon as an enrollee gets sick. People enrolled in these plans might seek care for themselves or for a family member only to be left out in the cold without coverage. No matter what the White House or my colleagues on the other side of the aisle cook it up to, the American people have said time and time again that they oppose plans that rip health care coverage away from those with pre-existing conditions. While the motion does not attempt to fund vital public health services and programs that have long garnered bipartisan support, the funding levels fail to provide greater investments to these programs. I know that we can work together to fund these programs, but keeping the administration's junk plan rule on the books would harm public health and not help it. We don't have to make these false choices. This underlying bill combines key pieces of legislation that lower drug costs, strengthen health care, reverse the sabotage, and rescind the administration's junk plan rule. And we are making it easier for American families to assess and sign up for affordable health care. We are making sure that plans cover essential health benefits like maternity care and treatment for substance use disorder. We are making sure that patients do not face annual or lifetime caps. We are making sure that patients are not discriminated against based on their pre-existing conditions, like myself. This is what we are elected to do for the American people. Republicans claim to support protections for pre-existing conditions, but they have failed to condemn the administration's decision asking the courts to invalidate the entire ACA. They have failed to call on the president to reverse course. They refuse to join us in condemning the administration's refusal to defend the law of the land. If our colleagues on the other side of the aisle are serious about protecting pre-existing conditions, they will support the underlying bill and defeat this MTR. Actions, not words, is what the American people demand, and it's what they deserve. Democrats are committed to putting consumers first. We will fight relentlessly to protect individuals with pre-existing conditions and expand coverage to more Americans. We will make sure no one, absolutely no one, has to choose between a prescription drug or their mortgage. That is unconscionable. And I urge my colleagues to join us in standing for ensuring Americans have access to affordable health care and prescription drugs. I stand in opposition to this MTR. I urge my colleagues to join me in opposing the political ploy that would hurt American families, those with pre-existing conditions, and those who are trying to afford their health care and prescription drugs.